Hey, Mr. Burke, good morning. My name is Dr. Katherine, and I'll be performing your operation this morning. Due to the several heart attacks you've experienced in the last year, your heart is at severe risk for failure. That's why we need to operate immediately to give you a new heart.
Hi, Mr. Burt. I'm Nurse Lindsay. You'll be given a general anesthetic so that you are unconscious during the procedure. As the heart transplant recipient, you must take medications to prevent your immune system from rejecting the new heart.
Hi, Mr. Burt. I'm Veena, Nurse Veena. We will also watch for side effects for the immunosuppressant medications, which include diabetes, infection, kidney disease, cancer, and high blood pressure. We will monitor these side effects and your progress in the ICU while you recover. When you wake up, you will move to a special recovery unit for rehabilitation. You can expect to be kept in the hospital for 1 to 2 weeks.
And don't forget, Mr. Burt, you're in really good hands.
Oh, hey, what's up? Okay, so we're in the operating room, and the thing is that I actually don't know how to do a heart transplant, so I'm gonna have to get some help from my nurses. So I'm gonna page my nurses in. Nurse Veena and Nurse Lindsay to the OR, please. Nurse Veena, Nurse Lindsay. Oh my God.
Hi, Dr. Katherine.
Oh my God. Okay. Well, they're very punctual, so let's get started. I guess the first step to performing a successful surgery is learning about the patient's medical history. So. What's the deal with Bert here?
So Mr. Burt is a 40-year-old Caucasian male who has been experiencing hypertension, also known as high blood pressure, and high LDL, low-density lipoprotein, cholesterol levels for the past 10 years. His family also has a history of heart disease. High blood pressure and high cholesterol are symptoms of coronary heart disease, or CAD for short, which causes about 600,000 deaths in the U.S. every year. CAD involves the progressive narrowing of the arteries that nourish the heart muscle. The narrowing is due to a buildup of fatty plaque, or atherosclerosis, along the artery walls. These deposits are composed mostly of cholesterol, other lipids, and fibrous tissues such as collagen. CAD appears to be a lifelong process in some people, beginning at an early age and progressing slowly until the vessels become so occluded that the heart muscle no longer gets adequate nourishment.
What is his liver?
The blockage of the coronary arteries prevents oxygen-rich blood from supplying the heart and leads to a heart attack. The underlying cause of CAD is unknown, although it is seen most frequently in people who live in industrialized nations. A heart attack is similar to a traffic jam. When too many cars flood the street, traffic does not move, and no one can get to their destination. This parallels how not enough blood can get to your heart during a heart attack. Imagine suddenly having fewer lanes on the highway during rush hour. What a mess.
Wait, you were talking about heart attack? What's a heart attack again? I don't remember.
A heart attack, or myocardial infarction, occurs when your heart stops beating properly because it's not getting enough blood. This usually happens because fat has gradually built up over time in the arteries in your heart, making them get narrower and narrower. When your arteries are very narrow, your blood can't flow through them properly and your heart doesn't get enough blood. When the heart stops receiving blood, the cardiac muscle is not receiving the nutrients it needs and quickly dies. This muscle cannot be repaired, and when part of the heart dies, it can no longer pump blood throughout the body. Bert here has experienced 5 heart attacks in the last year alone.
Whoa.
The first 3 were minor episodes. However, the last and most recent 2 were pretty severe and caused extensive damage to the cardiac tissue.
So how does someone know if they're having a heart attack?
So most heart attacks begin with subtle symptoms. These include a tight ache or squeezing sensation in the chest, pain that spreads beyond chest to the upper body, such as the shoulder and arms, or to the stomach, which may feel like heartburn.
Right there.
The chest discomfort may come and go. Other symptoms include shortness of breath, anxiety, lightheadedness, sweating, or even nausea and vomiting.
If someone believes...
Whoa. That was aggressive. Okay. Just ripping out lungs at this point. Alright. There's my watch. I think I'm gonna leave that in there. Make sure he has a good internal clock at the end of this. We can't get him a good heart transplant, so I'm just gonna leave that. That looks good. Alright.
Good decision.
Thank you.
So if someone believes they're having an attack, they should call 911 or other emergency medical services right away. They shouldn't try to tough out heart attack symptoms for more than 5 minutes. Once they get to the hospital, staff will begin treatment by clot-busting medicines and percutaneous coronary intervention, PCI. PCI is sometimes referred to as coronary angioplasty.
Do you need a pillow, Bert? This looks soft. I'm gonna leave that there for you. Or not. Okay. Alright.
Clot busters are used to dissolve blood clots that are blocking the coronary arteries. Ideally, medicine should be given as soon as possible. In angioplasty, a thin, flexible tube with a balloon or other device on the end is threaded through a blood vessel.
Looks like he's talking on the phone. Hello.
It does.
Hi. Okay. Sorry.
So the flexible tube with a balloon on one end is threaded through a blood vessel, usually in the upper thigh, to the narrowed or blocked coronary artery. Once in place, the balloon is inflated to compress the plaque against the wall of the artery. This restores blood flow through the artery. During the procedure, the doctor may put a small mesh tube called a stent in the artery. The stent helps prevent blockages in the artery in the months or years after the procedure.
So obviously, this is a pretty big surgery, and someone probably doesn't want to wait to, have heart attacks and such to get treated for coronary artery disease. So, how is it kind of treated in the stages, before all of this?
Right, so there is no cure for CAD currently. However, there are procedures available to treat it. Both angioplasty and coronary artery bypass grafting are used to treat blocked coronary arteries. Medicines used to treat CAD include anticoagulants, also called blood thinners, aspirin, and other anti-clotting medicines, ACE inhibitors and beta blockers for treatment of hypertension, statins, and fish oil and other supplements for omega-3 fatty acids.
So, coronary artery disease, I think, it's pretty prevalent in the United States, is it not? So, people probably don't want to get it in the first place. So what are some, preventative steps that people can take?
So there are a lot of easy ways to stay heart healthy. One of the biggest things is to quit smoking if you already do smoke, or to avoid secondhand smoke. Research has shown that smoking increases heart rate, tightens major arteries, and can cause an irregular heart rhythm, all of which put more stress on your heart, which can lead to a heart attack. Smoking also raises blood pressure.
Nope, I don't want it. I don't want it. I don't want that. Okay.
Smoking also increases blood pressure, which increases the risk of heart attacks. Make sure to maintain a healthy diet and exercise regularly to boost your heart health.
Okay, so we are almost out of the woods. I just need to trim his esophagus. That's procedure, right? Like trim esophagus. That's a step.
Are you sure about that?
Well,
I don't think that's something.
I don't think that's a step, but since you've already cut half of it, you might as well just cut it all off.
it's true. Go all out. I don't really do things halfway, But, plus, he was suffering from coronary artery disease. That must mean that, probably eating a lot. So, I think it's best if he doesn't have his esophagus anymore. Just going for my surgeon instincts here. So, we're going to take out his old heart. Look how gross that is. Like, I just kind of rip it, wiggle it a little.
Your fingers are attached.
Oh, all right. So, look how gross. Okay, let's do a little side-by-side comparison. And use the heart to open the box. Okay, look at that.
Whoa,
Look how
gross.
All right, let's get that out of here. Bye. All right, so brand new heart going in. Grab it and just kind of drop it in, right?
Mm-hmm.
Looks like the body's rejecting it. So. Just gonna kind of go in, reposition a couple times. Typically, it takes 3 tries to get it in just right. So let's see. Try 2. Interesting. Yay! We did it! Oh, I got a C on the surgery. It means awesome. C for really cool surgeon and nurses. All right.
Go team.
Hooray! Go team. High fives. High fives. All right, let's get
bloody high fives.
Yeah, my hands are a little. I didn't really wear gloves. Oops.
Neither did we.